Good morning, everyone. My name is Greg Seigan. I'm the Senior Director for Medicare 411. We are an independent insurance agency specializing in senior health care. I was here last year and met several of you, and meeting several of you vicariously this morning. I want to thank Oak Trace for inviting me, and also especially for Rachel Holtrup and her communication. You have a handout. If you don't, you can get one from Rachel with kind of an encapsulation of what I'm going to be talking about. What I'm here to do is not to tell you what to do or how to do it. I'm here to show you what all of your options are. I'm going to do it generically. I will not be mentioning any specific insurance carriers' names. However, I'll let you know what your options are. If after this you want to pursue any of those options, I'll be happy to help you, give you information, give you costs, specifics, and if everything works, help you enroll in a new or an alternate plan. Most of you have, in fact, I think all of you have Medicare right now, and you have either a Medicare supplement, known as a Medigap plan, or you have a Medicare Advantage plan. Those are the two roads that you can take with subsidizing your basic Medicare. So let me touch on the Medicare supplements first. If you have a Medicare supplement, you can go to any doctor, hospital, lab, or medical facility anywhere in all 50 states that accepts Medicare and accepts new patients. If you're out of state, and for example, out west in Colorado, for example, you wanted to see a podiatrist, you call the office and ask them if they take Medicare. 99% do, they'll say yes. Ask if they're accepting new patients, they say yes, you go. You don't need any approvals, you don't need anyone to tell you it's okay, you just go. And how it works with a Medicare supplement is the bills from the doctor or medical facilities are coded and sent directly to Medicare. Medicare pays their agreed portion, and then whatever they do not pay, they will send to the insurance company that you have your supplement with, and based on the plan that you have, Plan F, G, M, or N, for example, that insurance company will pay what your coverage is. If you have a Plan F, like in Frank, you should not get a bill. Medicare pays their portion, the insurance company pays 100% of the balance. As part of that 100%, they also pay your Part B deductible, which is a Medicare deductible annually. It's not an insurance company deductible. And in a lot of cases, especially within the last few years, you are paying a premium that not only covers that deductible, but also gives the insurance company a little extra money to make that payment. If you move to a Plan G, you make that payment yourself. It's accumulative, and in some cases, you can save yourself some money. With an Advantage plan, it's a little different. Medicare does not receive the bills. The bills go directly to the insurance company. What Medicare does is Medicare has an allotment that they've set aside for you for years, if you want to think of it as kind of an escrow account, and to take care of you when you turn 65 or go on Medicare. With a supplement, Medicare is using that allotment to pay your bills. With an Advantage plan, Medicare is giving that allotment to the insurance company. That's why you can get a Medicare Advantage plan for zero premium. The insurance company is receiving monthly money from the state for that. And the rates vary in different states. Why would you consider changing either of these plans? Well, your needs, your health needs, your income needs change. Medicare supplements do go up pretty much on an annual or a biannual basis. If your premium goes up a lot, you may want to look at switching to another insurance carrier that's going to give you the exact same coverage. However, they're going to put you into the underwriting department, which is going to ask you questions to see what your health situation is. There are about 16 questions that every insurance company will ask you. In the insurance world, we call them the knockout questions, because if you say yes to any one of them, you will not be able to switch. They're very serious health needs. If you've had strokes, heart attacks, kidney disease, HIV, dementia, etc., you're not going to be able to switch. So if you're interested in finding out what those questions are, you can either send me an email or you can contact Rachel here. She'll have a list of them, and you can see if you qualify. Now, if you have an Advantage plan, they change. Nice part about the Advantage plan is Medicare told the companies in the early 2000s, when they decided to go to an Advantage plan, that the insurance companies had to cover all the basics of original Medicare, and in addition, provide some other benefits, for example, dental, vision, and some home health care benefits. You're seeing a lot of advertising on TV right now for Medicare Advantage plans. And one of the problems with the advertising is they're not giving you all the information. They're using the word may, they're using the word might. And for example, there's a ex-sports football player who gets on and tells you, you're going to get all this for nothing. It isn't going to cost you a dime. You're going to get this for free, that for free. It includes dental, vision, hearing, free meals, all transportation. And quite honestly, that's not really correct. There are plans that include most of those items. But here in Illinois, I do not know of a plan that includes all of them where it doesn't cost you a dime. As my father told me years ago, there's no such thing as a free lunch. Somebody's paying for it. So if you're going to look at an Advantage plan, you need to look at all the different benefits, costs, and Medicare Advantage, it's kind of a pay-as-you-go situation. If you go in the hospital, you're going to pay for each day you're in the hospital, up to 7 days, and on the 8th day, Medicare kicks in, up to 90 days. The amounts for your hospital stays will change depending on the plan that you have. So it's very important to go over all of the different benefits of your Medicare Advantage plan. This is the time of the year to do it. If you want to change Advantage plans, you have between the 15th of October and the 7th of December. And if you make any changes, they will take effect on January 1st of 2021. Doesn't cost you anything to shop, doesn't cost you anything to investigate, and then you have some time to enroll if you want to make a change. If you want to change from one Advantage plan to another during this time, you will not go through all those questions for enrollment. So it's pretty much easier to change to an Advantage plan or to change from a supplement to an Advantage plan during open enrollment. One of the common misconceptions is if you want to change your supplement, that you have to do it during open enrollment. That's not true. You can change your supplement from one insurance company to another in March if you so desire. The other thing we look at this time of the year is our Part D prescription plans if you have a supplement. And they do change frequently. A lot of new plans come out. One insurance company 1 year will have an advantage, another one will have an advantage the following year. So it does make a lot of sense to at least check your Part D plan. In September or the beginning of October, if you have a Part D prescription plan, you should be getting something called an ANOC letter. That's an acronym for Annual Notice of Change, where the Part D plan tells you what your premiums are going to be for the following year, whether your drugs that you have are covered for the following year. What we ask people to do is send us a list of your prescriptions. We need the name of the drug, we need the dosage, and how frequently per day you take it, so we can figure out what your costs are going to be with a different plan. Some of the plans, the premiums will go up or down, and it's not just the premium that counts. You have to look at the total cost of the premium plus whatever your monthly prescriptions are going to cost. You may have, for example, and I'm going to use round numbers, You may have a Part D plan that has a $15 a month premium. And then your drugs, based on the tiers, you could either have zero copay or be paying for tier 3, 4, and 5 drugs. So you want to look at the cost of the premium plus the cost of the drugs. A plan with a lower premium doesn't necessarily mean it's going to cost you less money, because you may be paying more drugs, more money for your prescriptions, whereas a plan with a little higher premium may cover those prescriptions a little bit better. So you need to look at both, and that's one of the things we do for everybody. We take a look at the entire picture for that. Why would you consider changing your Advantage plan? Well, they change every year. Some of them stay the same. If you have an Advantage plan that you're happy with, then there's really no reason to change unless there's something that you're looking for that your plan doesn't offer. When you have an Advantage plan, you will get benefits. You will get some vision, some dental. Some of them offer hearing, some don't. Most of them today will offer a what they call a home meal after you've been hospitalized. That's one of the misconceptions on the TV. They'll say, yeah, sure, you get free meals, home delivered meals. Well, yeah, not any time, but only after you've had a hospital stay. So that's another misconception. Now, I'm aware that there's not a pharmacy here at the facility, so most of you go to Costco, Walgreens, Meijer, CVS, Costco, Sam's Club, etc. to get your prescriptions filled. It's another thing you want to take into consideration when you look at your plans, whether it be a Part D prescription or a Medicare Advantage plan, to see which of those facilities is going to give you a better deal on the prescriptions you're taking. Just an example. You have a Medicare supplement, Medicare Part D plan with ABC Company. That plan has preferred and standard pharmacies. Preferred pharmacy, your drugs are going to cost you a little less. Standard pharmacy, a little more. You're not buying a plan for a pharmacy. You're buying it through the insurance company, and then they allow you to go to different pharmacies, but you really need to look and see where your drug costs are going to be lower. Here's another example. You have a Medicare Part D prescription plan, and it allows you to go to Walgreens and Costco and CVS. Then you look at the cost of the drugs. At two of those companies, you may have a zero copay, and at the third company, you may have a $6 or $8 copay. So you have the option. You can go to anyone you want, but you can also wind up paying more for your prescriptions. So it's a matter of, again, your choice, whether you want to use a pharmacy that's going to give you your drugs at a lower cost. If you're used to working with a certain pharmacy and paying the extra cost is not a big situation for you, then again, you have the option. Now, it used to be where you couldn't change plans after December 7th. And a couple of years ago, they passed a enrollment OEP, an optional enrollment period between January and March 31st, where you can switch your prescription plan and your drug plan, but you get a one-time chance during that period. Why would you want to do that? Well, unfortunately, some people sign up for a plan with an agent, and an agent talks them or convinces them to sign up with this plan because that may be the only plan that agent is contracted with, whereas there might have been a better plan. So you sign up for that plan, then you find out in January, my gosh, there's a better plan available. You have a one-time chance to change that. Some of the other issues that you should be considering at this time of the year, if you have a Medicare supplement, you do need a separate dental vision plan. There are many available. You can sign up or disenroll at any time of the year. There's no special time. Some of them have very strict networks that you need to stay in, otherwise they will not reimburse you. Some of them you have to stay in the plan for 6 months before you can submit a request for a reimbursement. Some of them will cover you the day after they issue it. Some of them you can see a dentist, any dentist or vision anywhere, and what they'll do is they'll reimburse you more if it's in network, less if it isn't. And then there are other plans where you can go anywhere you want, and they'll reimburse you whatever the cost is. There's plans that have advantages. The longer you stay in them, the higher the percentage of reimbursement is. And it's kind of like if you think of it like a mileage plus program with an airline, where the first year they may reimburse you 50%, and the second year 60%, and they may go up to 70% after 3 or 4 years. So again, lots of options with dental and vision plans. The options also that you should be looking at that are non-essential, you're not required, there's no penalties involved, and those are cancer and final expense plans. If you have cancer in your family and it's predominant, you should consider a cancer plan. There's several again available, and you pay a monthly premium, and if you are diagnosed with cancer within a very short period of time, you're issued a check for whatever coverage you signed up for. Whether it's $2,000, $5,000, $10,000, $20,000, whatever, they give you a check. A lot of people will say, well, gosh, my insurance should be covering all that. Well, yeah, but there are a lot of expenses that you might have that aren't covered by your plan. For example, maybe you want to go to the Anderson Cancer Clinic down in Houston. You're going to have to fly down there. You're going to have to stay in a hotel. Those expenses are not covered. So your cancer plan would cover that. If you need to bring someone into your home, or in this case, probably not if you're living here, but if you're living in a house and you can't shovel the snow, cut the grass, clean the gutters, that extra money from the cancer plan will help you. Final expense plans are pretty self-explanatory. You get a lump sum of money that you can leave for your beneficiaries to cover the cost of putting your affairs to bed at the end. That pretty much covers all of your options, what you can do, what you can't do. If you have any questions, feel free to contact me. Reaching me on the phone, my cell phone is the best. I am in and out quite a bit. However, if you call the office and I'm not in, you can leave a message. My email is on here, or you can contact Rachel, and she'll have information, or she can get a hold of me. So with that, I will wind up. If anyone, again, needs information, I'll be happy to supply it. I want to let you know here that I do not charge for my services. If I write your insurance, the insurance company will compensate me. So in working with me, there is no charge for my services. And if you were to do your enrollments online by yourself, the rates that you would get from the insurance companies are not different than the rates I'm going to give you. I do represent about a dozen of the major health insurance agencies in the state of Illinois for senior health care. So I'm going to look for the best plan that gives you the best coverage. That's the most important. And then we'll look to make it as economical as possible. So again, thank you for your time. Thank you for your attention. And I'll look forward to helping any of you that need help.